Hi, my name is Dr. Hani Botros. I previously published a couple of videos on YouTube making a connection between the level of ultraviolet radiation in Australia and COVID-19. The first video was titled COVID-19 got killed by ultraviolet rays, and the second video provided evidence to support the idea. In this video, we'll discuss how the level of ultraviolet rays affected the outcome of outbreaks of COVID-19 in 3 major cities in Australia. Now we look at the ultraviolet index charts courtesy of the Australian Government Protection and Nuclear Safety Agency. The ultraviolet index charts are updated regularly, and you can refer to the agency website for more information and for the updated charts. Here is a chart for the ultraviolet radiation index for the city of Brisbane, Queensland. A chart of the ultraviolet radiation index for the city of Sydney, New South Wales. A chart of the ultraviolet radiation index for the city of Melbourne, Victoria. We clearly see that the level of ultraviolet index is different in the 3 major cities in Australia, namely Melbourne, Victoria, Brisbane, Queensland, and Sydney, New South Wales. Although the ultraviolet index dips in the 3 cities during the months of June and July of every year, however, it remains in the moderate range for Brisbane and remains in the low range in Sydney and Melbourne. This explains why skin cancer is more common in the state of Queensland in comparison with the states of New South Wales and Victoria. It may also explain why the state of Queensland didn't have major outbreak of COVID-19, as the ultraviolet index never dips into the low range and stayed in the moderate range even in the months of June and July. As of today, the 18th of July 2021, the number of confirmed cases of COVID-19 in Australia since the start of the pandemic are as follows. More than 31,000 confirmed cases in Australia. More than 20,000 confirmed cases in the state of Victoria. 6,527 confirmed cases in the state of New South Wales. 1,754 confirmed cases in the state of Queensland. The total number of deaths in Australia since the start of the pandemic stand at 913. 820 deaths were from the state of Victoria. 59 deaths were from the state of New South Wales, and 7 deaths were from the state of Queensland. We can make a correlation between the level of ultraviolet index in each of the 3 states and the number of confirmed cases and deaths. The higher the ultraviolet index, the lower is the number of confirmed cases and the number of deaths. We need to think that the outcome of every outbreak of COVID-19 in Australia is the result of balance between 2 factors. One factor is the viral load, how many people carrying the virus in the community, and the other factor is the ultraviolet index during that time period. The current outbreak in the cities of Sydney and Melbourne can be explained by the low level of ultraviolet radiation index. If you like this video, please like, share, and subscribe. Thank you for watching.